and davantas apple, cider vinegar, scientific explanation of its health benefits. Introduction. Why apple cider? Vinegar deserves scientific attention. Apple cider vinegar is often spoken about casually, as a folk remedy or a weight loss trend. But when examined scientifically, ACV is not magic nor myth. It is a biochemically active fermented product that influences blood sugar regulation, insulin sensitivity, gut microbiome, digestion, metabolic pathways, appetite regulation, inflammation. Its benefits arise not from belief, but from acetic acid, fermentation byproducts, organic acids, polyphenols, and metabolic signaling effects. What is apple cider vinegar biochemically? Apple cider vinegar is produced by 1. Fermentation of apple sugars, alcohol. 2. Conversion of alcohol, acetic acid by Acetobacter bacteria, key bioactive components. Acetic acid, 4 to 6%. Malic acid, lactic acid, polyphenols, potassium, small amount, probiotic residues in unfiltered with mother, ACV. Acetic acid is the primary active molecule. 1. ACV and blood sugar control, strongest evidence. Mechanisms: improves insulin sensitivity. Acetic acid enhances insulin receptor signaling in muscle and liver cells. Reduces hepatic glucose production, ACV, suppresses gluconeogenesis in the liver. Slows gastric emptying. This reduces the speed of glucose entering the bloodstream after meals. Reduces starch digestion. ACV inhibits alpha amylase enzymes, slower carbohydrate breakdown. Scientific findings: lower fasting, blood glucose, reduced post-meal glucose spikes, improved insulin sensitivity, reduced HbA1c with regular use. ACV is especially useful in prediabetes and insulin resistance. Second, ACV and metabolism, AMPK activation. ACV activates AMP, activated protein kinase, AMPK, the body's metabolic master switch. AMPK activation leads to increased fat burning, reduced fat storage, improved mitochondrial efficiency, reduced lipogenesis, fat creation. This is the same pathway activated by exercise, fasting. Caloric restriction, ACV mimics mild metabolic fasting signals. 3. ACV and digestion, not acidity as people think. Although acidic, ACV often improves digestion, especially in people with low stomach acid. Mechanisms: stimulates gastric acid secretion, improves protein digestion, enhances mineral absorption, improves bile flow, reduces fermentation and bloating. Many people with acidity actually have low acid, not high acid. ACV should be avoided in true hyperacidity or active ulcers. While 4. ACV and gut microbiome. ACV supports gut health by suppressing pathogenic bacteria, supporting beneficial microbes indirectly, improving gut barrier function, reducing endotoxin, LPS, absorption. Fermented acids improve the gut metabolic axis, which strongly affects insulin resistance and inflammation. 5. ACV and cardiovascular health. ACV may help reduce triglycerides, improve HDL function, reduce LDL oxidation, improve endothelial function, lower mild hypertension via insulin improvement. These effects are secondary to metabolic improvement, not direct drug-like actions. 6. ACV and weight management. ACV does not burn fat directly, but helps through improved insulin sensitivity, reduced appetite, increased satiety, reduced cravings, better metabolic signaling. Studies show reduced calorie intake, reduced visceral fat, modest but consistent weight loss. ACV is a support tool, not a standalone weight loss solution. Bioactive, and 7. ACV and inflammation. By improving glucose control and insulin signaling, ACV reduces chronic low-grade inflammation, reduces oxidative stress, improves mitochondrial efficiency. This indirectly benefits joint pain, fatigue, metabolic inflammation, fatty liver. ASCATE, ACV and liver health. ACV supports liver health by reducing insulin resistance, reducing fat accumulation in liver, improving bile flow, improving gut-liver axis, reducing endotoxin burden, useful in early fatty liver, not advanced liver disease. 9. ACV and mineral absorption, organic acids, improve absorption of iron, magnesium, calcium to some extent. This is relevant in people with low stomach acid or poor digestion. How to use ACV correctly, important. Recommended dose: 1 tablespoon, 15 milliliters, ACV, in 1 glass, warm water, once daily, morning or before meals. Optional: pinch of salt for adrenal support. Not with sugar or honey for metabolic benefits. Best timing: morning, metabolic priming, or before largest meal. Who should avoid or use with caution? Avoid or use cautiously if active gastritis or ulcers, severe acid reflux, advanced kidney disease, low potassium levels, dental erosion risk, always dilute. On potassium-sparing diuretics, never consume undiluted ACV. Common myths. ACV cures diabetes. It improves insulin sensitivity, not a cure. ACV melts fat. It improves metabolic signals. More is better. Excess causes irritation and harm. Scientific summary. Apple cider vinegar works because it improves insulin signaling, activates AMPK, reduces glucose spikes, supports digestion, improves gut metabolic axis, reduces metabolic inflammation. It does not work as a drug, it works as a metabolic signal. Conclusion. Apple cider vinegar reminds us of a core scientific truth. Small biochemical signals, used consistently, can create large physiological changes. ACV does not force the body to heal. It nudges the body back toward metabolic balance. In an age of chronic metabolic disease, insulin resistance, and inflammation, ACV stands as a simple, accessible, evidence-supported tool. When used correctly, not as hype, not as magic, but as applied nutritional biochemistry. Holistic Wellness Foundation, IMFAL, Healing Beyond Boundaries.